Dr. Miller, I'd like you to tell your audience about vitamin D3. I've been hearing you and a lot of people talking about vitamin D3 in these days. So please explain us a little bit more what is that has to do with our health and how good our body is for us.
Wow, that's a great subject, and it's the vitamin D3 is the most important vitamin in our diet. It's the most important vitamin in our overall health, and it's very underappreciated. We find that vitamin D3 is essential for good bones. In fact, if people have good levels of vitamin D3, they probably won't have hip fractures and things like that. But more than that, vitamin D3 is essential for our immune system. Our immune system is what fights off viruses and bacteria. For example, most people that died of COVID were very low in vitamin D3. The other thing it does, it fights off cancer. There's at least 9 different cancers that can be almost prevented totally with adequate amounts of vitamin D3. In addition to that, vitamin D3 is essential for our well-being. We found in many tests that vitamin D3 is far more effective in treating depression and suicide ideation than all the SSRIs and anti-depression medication put together. So it's extremely important for us in our modern day health, and it's much underappreciated. So my message to the audience, my message to the people in the United States is be sure your vitamin D levels are up to normal.
Getting our vitamins and what else?
Well, naturally, vitamin D3 comes from the sun. Okay. We don't get very much vitamin D3 from any of our foods. And so what happened was, in nature, over the years, the caveman, even back in our grandparents' days, people were out in the sun all day. And the body manufactures vitamin D when the sun hits our skin. And it manufactures approximately 25,000 units of vitamin D3 per day when you're out in the sun.
I'm really concerned because of skin cancer, they always talk about that. So you have to protect yourself. So I'd rather not be on the sun. So is that really, I'm harming myself, and this for a long run is going to be an affection to me?
All right, you brought up a very good point, and that is there are some bad detrimental effects of getting out in the sun too much. It dries out your skin, makes it age. You can get skin cancer and so on. And our modern life just doesn't allow us to be out in the sun very much. We're inside working most of the time. We don't have the opportunity to get out every day for hours in the sun. So we're not doomed though, because there are great supplements of vitamin D3 on the market today, and these supplements are made naturally. And so we can take those supplements of vitamin D3 to make up for our time that we're missing out in the beautiful sun.
So I take my multivitamins, it has vitamin D3. Is that enough? Is that good enough for me, or should I take more?
What a great question, Monica. I'll tell you what. Over the years, the CDC, the FDA have totally missed the mark on what is the normal level of vitamin D3. In fact, they warn people about taking too much, and they would get vitamin D-osis or toxicity from vitamin D3. A study just came out now of over 5,000 patients for 7 years in a hospital in Ohio. And this is a great study because they gave these people 25,000 to 50,000 units of vitamin D3 every day. And for all those years, they never had one side effect from those high doses. The government recommends 400 units. Really? 400 units, not 25,000 or 5,000 units. So they missed the mark completely over the years, and now science is finally catching up. Now, if we look back at history, for example, my grandmother lost 7 of her siblings to tuberculosis. Back then, they had no antibiotics for tuberculosis, but they learned that if they put these patients with this fatal disease out in the sun just to rest, and they put them out in the sun, oftentimes tuberculosis was cured just by the sun. They didn't know the sun was generating vitamin D. They just thought the sunshine was good for their health, but it cured tuberculosis. So nowadays, we can have the best of both worlds. We can keep out of the sun to keep our skin looking young and healthy and not cancerous, but we can still get enough vitamin D3 from our diet.
So I heard you doing some tests in the clinic that you work at Acacia. Could you tell us a little bit about that D3 test that you were doing to the whole clinic patients?
Yeah, this is a very good point that Americans are extremely low in vitamin D3. At our clinic at Acacia Medical, for a couple of years, we were measuring everybody's D3 levels. It was a very expensive test, but we thought it was important because we knew how important vitamin D3 was. It turned out that 95% of all those patients were very low in vitamin D3. And because of that, we just stopped all those expensive tests, and instead we just started giving people vitamin D3. It saved us over $6,000 a year in tests. But even then, what they call normal levels are not normal levels. We found out from this recent test that was done up in Ohio that normal levels in our body, you have to take vitamin D3 for several months to get the levels back up to where they should be. So my recommendation to everybody, based on this study and what we know today, is that everybody should take a minimum of 5,000 units of vitamin D3 every day, up to 25,000 units of vitamin D3 every day. Do not forget your vitamin D3. While you're taking it, go ahead and take your zinc and your vitamin C too. But vitamin D3 is the star of all vitamins, and it's the most essential to our good health and our mental status.
So you think that your immune system is weak, especially now with COVID, it's all over again. People are not taking enough and it's not fighting the COVID because they have this deficiency?
Right. I can't say if you take an adequate number of vitamin or milligrams of vitamin D3 every day that you will never get COVID. But your chances of getting COVID are way, way diminished, probably to less than 5% that would be if you were deficient. So it's extremely important to use vitamin D3 to prevent yourself from getting not only COVID, but influenza and all these diseases that are going around today, the infectious diseases. Let me say one other word about why the message is not getting out so much. And it has to do with money, okay? There are no drug companies that are going to be advertising vitamin D3 because it's so cheap they're not making any money on it. They'd rather sell you SSI drugs to drug you out, make you a zombie, which they can charge you hundreds of thousands of dollars for, and they make billions of dollars on these drugs. Whereas vitamin D3 is almost free and it would prevent that. So we're having to fight Big Pharma on this because they're going to try to discredit any great studies that are done on vitamin D3 in favor of studies of using their toxic drugs instead. So keep that in mind. Don't let the Big Pharma fool you. Remember nature. Remember the sunshine that God gave us and the skin that we have to manufacture this.
Oh, wow. Thank you so much.